A generation ago, TV shows like The $6 Million Man and Bionic Woman seemed like far-fetched science fiction fantasy. In retrospect, they were a crystal ball into the future, where medical science can now regrow body parts and heal once untreatable conditions.
The IED went off underneath my vehicle. And next thing I know, we're on fire.
They found me about 20 feet from my truck, engulfed in flames. My family was informed that they had to fly to Germany to basically come say goodbye.
Scott Blaine and Joseph Paulk are among the 1,000 soldiers who've come home from Iraq and Afghanistan terrified to look in the mirror.
40% burns to the face, shoulder down to my hands, and hip down to my ankles, and then amputations to all 10 fingers because of how severe the burns were.
Now scientists may be able to help soldiers like Joseph by growing new body parts.
We return function and quality of life to these patients.
At the University of Pittsburgh, researchers use powder made from a pig's bladder to regrow fingers. For Joseph, they will create new fingertips.
Stimulating the growth of 10 to 11 millimeters of length allows them to make change at a grocery store, turn the key in their car, hold a fork.
At Massachusetts General Hospital for Children, researchers are working to reconstruct faces. Here, doctors are engineering ears.
Ideally, it would be indistinguishable from a normal ear.
Dr. Joseph Vacanti has had success in mice and plans to implant his first human ear this year.
We can now envision that someday we can give somebody back their own face.
Down the road at Brown University in Rhode Island, work is underway to restore injured nerves.
We're trying to help nerves that are injured grow back in a directed way.
They do it by pouring liquid plastic over cells in a mold to guide severed nerves back together.
Those live nerves will follow exactly along the tracks where the plastic is that looks just like cells.
Here's normal, here's the fovea. And this
researchers are also looking for cures inside genes.
I was diagnosed with my eye condition at age 5.
Dale Turner was just learning how to read when doctors diagnosed a dark future.
The doctors said I would be completely blind at age 10.
Dale inherited a form of blindness called Leber's congenital amaurosis. It's caused by a defective gene that prevents Dale's retina from producing the nutrients his eyes need, creating tunnel vision.
You always have the hope that, there'll be something for your incurable condition.
After years of searching, Dale and his parents found an experimental therapy. Doctors injected hundreds of billions of copies of healthy genes into the retina. So far, 4 out of 6 patients in the trial regained vision.
The improvement in vision corresponded exactly to where the vector was put, where the genes were replacing the defective genes, in other words.
I could see colors never before, and it was just, I saw a blue sky like I've never seen it before.
Right now, there are more than 1,500 gene therapy trials taking place all over the world, covering everything from eyes to cancer to heart disease. There you go. Research moves forward, but for some patients, it's not quick enough. Barbara McKeon has chronic lung disease.
I was on oxygen around the clock, 24/7.
Recording engineer Howard Lindeman has coronary artery disease.
99.9.9.9% blockage everywhere.
Each of them paid $64,000 for a controversial stem cell treatment that is not approved for use in the U.S.
We're able to increase heart function in patients that have suffered major heart attacks.
Cardiologist Zanos Grekos oversees a therapy that sends patients and their stem cells around the world. First, the patient's blood is sent to a lab in Israel, where scientists extract, grow, and activate stem cells that target specific organs.
We grow them in a special culture medium that includes growth factors and other cytokines or interleukins that tell the stem cell what to become.
Then the patients travel to the Dominican Republic or the Bahamas, where they are reunited with their stem cells through a surgical procedure that can't be done here in the U.S.
That tends to be the case with the U.S. and the FDA, that many things lag behind.
But is there value to that delay? Critics say the claims are too good to be true.
It's a scam.
I don't see any other way to characterize this.
But Barbara McKeon doesn't care. She says the treatment gave her life back.
One pulmonologist told me that my life was pretty much finished. I've got a picture of me at the top of that hill smiling because I was so happy I could do it.
Keep in mind that the placebo effect is very powerful. It can fool patients, it can fool other physicians.
So in the whirl of breakthrough medicine, is this controversial and amazing or a scam? And how do you know who to believe?
Ask your normal health care provider and your normal physicians whether this seems like a reasonable treatment. What's the evidence that this treatment works? What are the side effects?
Bottom line, never stop your search. Just be smart about it.